These are tiny silent troublemakers, what we are going to talk about today. Welcome to Ayur Varta once again with me, Dr. Pooja, in association with Aviral Hospital, and we have with us Dr. Sandeep Mishra, sir. We welcome you, sir, once again.
Thank you, ma'am.
Let's talk about gallstones today, sir. Coming
Yes,
straight to question, what are gallstones and how are they formed?
ma'am, as the name suggests, gall stones are formed inside the gallbladder. So stones inside the gallbladder are known as gall stones. As we know that the bile is formed in the liver and it is stored in the gallbladder, and as per need, it is secreted in the duodenum. So when there are some metabolic disorders, and when the concentration of bile and bile salts changes, then this stone forms in the gallbladder.
Okay, sir. So it's changes in the metabolism which leads to the formation of gallstones.
Yes, ma'am.
Okay. So are all gallstones same or there are different types?
No, ma'am. No, all are not same. There are four types of gallstones. One is cholesterol stones, then brown pigment stone,
Okay, sir.
and then mixed stone, which is formed by the cholesterol as well as the pigment.
Okay, sir.
And last one is pigment stone. But most of the time we found cholesterol stones.
Okay, sir. So why is it so that some people develop gallstones in their life and some they never do?
This depend upon, ma'am, diet and lifestyle, obesity, diabetes, pregnancy, and metabolic disorders, and some medications. All these are
Responsible
responsible
for.
for formation of the stones, gallstones,
Hmm.
and some dietary habits like more fasting and all. All these may also cause bile stasis, and bile stasis leads to formation of the gallstones.
Okay, sir. So how can patient make it out themselves that the stones are existing? And what are the presenting symptoms that we find in the patient?
A very good question, ma'am. Sometimes patient only presents with dyspepsia.
Okay, sir.
Dyspepsia, heaviness after taking meal, after eating a small amount of meal, he fullness of abdomen is there. So if these things are there, he should think of that he might be suffering from gallstones, and he should go for near doctor for a checkup.
Okay, sir. So we have heard about silent stones. So what are they, and do they really affect the patient in long term?
Ma'am, silent stones, we call it when due to any other reason, if patient is going for ultrasonography and the stone is found in the gallbladder, then it is known as silent stone. That means it is not creating any symptoms, but it is there. So this is mostly in the case of cholesterol stones,
Okay, sir.
and it may be or may not form any complications, but we have to treat it if it is causing any symptoms.
Okay, sir. So what triggers a gallstone attack?
Mostly, ma'am, rich fatty diet or fatty meal triggers gallstone colics. So, if a person is suffering from gallstone, he is having gallstone, and he has taken a rich fatty meal, then after that, there are more chances to trigger gallstone colic or gallstone pain.
So it's usually after meals that the person will get the attack if gallstones are present.
Yes, yes, ma'am.
Okay, sir. So how do we do the diagnosis for gallstones?
Ma'am, ultrasonography is the gold standard for diagnosing the gallstones. And if the gallstones is in the cystic duct or in the common bile duct, it has moved to the common bile duct, then MRCP, magnetic resonance cholangiopancreatography, is the investigation of choice.
Okay, sir. How can we treat gallstones? With medicines or surgery is needed?
Gallstone, there are some medicine like some medication is there to treat the gallstones, but one should go for surgery. As there are many complications of gallstones, so one should get it removed by the surgery. And in surgery, if we talk about, we have three modalities. One is open cholecystectomy, one is laparoscopic cholecystectomy, and one is robotic cholecystectomy. So initially, it was done openly, in which there was a long incision given in the right hypochondriac region, and the gallbladder is operated manually. But nowadays we operate it through the laparoscopic surgery or robotic surgery, in which they are minimal. It is also known as minimal invasive surgery, in which we give just small incision, around 12 millimeter and 5 millimeter incisions, through which we put the laparoscope and instruments, hand instruments, and we operate it by visualizing it on the monitor. So it is a very good technique, as it causes less trauma and early recovery.
What age group do we usually find gallstones?
Ma'am, initially it was said that fat 40 female, fertile female are more prone for gallstones, but nowadays no age is rescued. From the very beginning, child to old age, we find gallstones, as the diet and lifestyle has changed a lot of from the last few years.
What if children get affected? Do you advise surgery for them or medicine in the early stages?
No, ma'am, surgery only, because gallstones may land up in the complications, so we go for surgery.
Okay, sir. What complications can occur if gallstones are ignored?
Ma'am, there are many complications and we classify them according to the location of the gallstones. Sometimes there are complications of the gallbladder when the stone is inside the gallbladder. Then it may be called gallstone colic, acute cholecystitis, chronic cholecystitis, perforation of the gallbladder, empyema of the gallbladder, mucocele of the gallbladder. So these are the complications when the stone is inside the gallbladder. And then second, we see the complications when the stone has moved through the cystic duct to the common bile duct. Then it may cause pancreatitis, it may cause obstructive jaundice, and next are the complications when the gallstones has passed inside the duodenum and it is in the intestine. Then it may cause intestinal ileus and
Okay, sir.
paralytic ileus, like that.
So
And
some warning signs?
perforation of the intestine also.
Okay, sir. So some warning signs for the patients?
Yes, ma'am. If the patient is having recurrent pain in the right hypochondric region, just below the right costal margin, then he should go to the nearby surgeon and get the USG done. And if he is suffering from the gallstone, he should get it removed as soon as possible.
Okay, sir. So looking at our lifestyle these days, how can we prevent gallstones?
We can prevent by, as in previous section also I have told, that diet and lifestyle are very important. If you control your diet, if you improve your lifestyle, then you can prevent obesity, you can prevent diabetes, you can prevent different infections by increasing your immunity. So these plays a major role, and one can by improving diet and lifestyle can prevent many diseases including gallstones.
So one last question. Like in your practice, how common is it?
Ma'am, it is very common, uh, and especially in females, it is very common because nowadays diet and lifestyle have changed a lot. We eat less leafy vegetables, and there are many ready-made food items on one call available, so it has increased a lot.
One take-home message for our UG, PG, and our audience, please.
Ma'am, please get it diagnosed early, as one get it treating like गैस ट्रबल, गैस बनती है, गैस ऊपर चढ़ जाती है, और इस तरह की बातें लोग सोच के इसको ट्रीट करते रहते हैं और लिंगर ऑन करते रहते हैं. तो बाद में होता क्या है कि अगर बहुत लंबे समय तक आपने गैलस्टोन को इग्नोर किया या उसको टाइमली डायग्नोज नहीं किया, तो कई बार सीए गैलब्लैडर होने के चांसेस होते हैं. और सीए गैलब्लैडर एक ऐसी बीमारी है जिसको हम लोग अगर जल्दी डायग्नोज कर लें तो प्रिवेंट कर सकते हैं, बट अनफॉर्चुनेटली कई बार बहुत लेट हो जाता है. तो मेरा मैसेज यही है कि अगर आपको फुलनेस ऑफ एब्डोमेन हो रही है, डिस्पेप्सिया हो रही है, तो अपने सर्जन के पास जाएं और एक अल्ट्रासाउंड करा के इसको डायग्नोज करवाएं. और अगर है तो फिर उसको डिले मत करें. एक बार स्टोन डायग्नोज हो गया तो उसकी सर्जरी में डिले ना करें.
Okay, sir. So thank you for providing such elaborative information on gallstones today. And I'm sure we all have got the message. Early awareness, timely diagnosis, and proper treatment is the solution to gallstones. So इसी तरह की वार्ता के लिए stay tuned to आयुर वार्ता. See you in the next episode. Till then, स्वस्थ रहें, मस्त रहें, व्यस्त रहें. धन्यवाद.
Thank you.